Sure.
And then,
Because I'm still unclear how to approach it, because when you are doing it, that's something different. And when you are
I know
telling somebody else to do something else, it is a bit tricky,
it is.
So,
And that is what I
and
have found, that
and
it's
college
more
has
tricky.
not actually provided any like clear cut a video sort of thing, how the station will run, how in regarding timings or something like that. They should actually, but strangely.
I think timing they have given, Harsh. If you
Mm.
look at the documentation,
Uh-huh.
uh, I will check also. I think in
The
the
timing should have been given, yeah, but how? I mean, what can you ask, and how to approach it? Like I'm asking, like now I am looking for cyanosis or clubbing. I ask them to do this, or I should ask like, is there any clubbing? There are two different ways, because if I'm
right.
asking a question, then you will give me answer whether there is, and or if I ask them to do this, or I'm doing, it's a bit tricky, but anyway, I think over time we'll know how it works. And
See, basically, we'll run through it a little bit, a very brief introduction. Then you would have a few universal cues,
yeah, yeah,
which could be an image, it could be an
sure,
X-ray, it could be a
it could be anything,
basic
yeah,
CT,
okay.
it could be a audio clip,
Hmm.
and you have 4 minutes to look at it.
Right,
And then in the short clinical, you will then go in and you'll be with the examiner.
sure. Mm. Right.
And there is the examiner will say, examine the respiratory system, cardiovascular system, or
Okay,
that information may have already been given to you when you were looking at the information.
sure. Okay.
And then uh, there are different ways of doing it. My suggestion is that you give a brief summary of what you have seen. And
Right.
brief means really brief, sort of that
Sure.
I've seen the universal cues.
Yeah.
I have to see, I'm seeing John, and
Right, right.
this is what I've seen in the universal cues.
Sure,
If it
sure,
makes
sure.
sense, that's fine. If it doesn't, then say if you have seen clubbing,
Yeah.
then what you would say at the appropriate time is, I noted clubbing in the universal cues. Is that correct? Now,
Right.
right? Now, if the examiner feels that your flow is smooth and you're doing a good examination, he may not
Right.
ask you to demonstrate how you will you do it.
Sure, I get it. Okay.
Yeah. But if you're struggling, then he can say, oh, okay, can you demonstrate? How will you check? Or if it is borderline and you're not quite sure,
Sure.
then you can say, oh, and he'll say,
Right,
how
right.
can you this? And we look at
Yeah.
this triangle or whatever.
Sure. Yeah, yeah. Yep.
Similarly,
Okay.
if you have a picture of a hand, there are only two things you'd be checking in a hand,
Hmm.
either clubbing
Yeah.
or cyanosis,
Yeah. Yeah.
isn't it? So you have to be kind of, I wouldn't say imaginative, but what you would be doing normally, here you have to verbalize, there you kind of mentally shift the
Sure.
information across.
Sure.
Okay, so let's go, let's have a go at it. Uh, and I think this is what I've found, that in the other group, that's what people are struggling with, is how to finish it in the required time.
Right. Okay.
And
Okay.
being systematic, that's the other thing. So
Mm.
remember, while we are doing it, inspection,
Yeah. Palpation,
palpation,
percussion, and auscultation. Yeah.
percussion if needed, auscultation. That's
Sure.
general as it would be. Uh, pick or examine the cardiovascular system or examine
Mhm.
the chest or abdomen or whatever, a general physical examination is always included, even if not said.
Yeah.
So spend 30 seconds or 40 seconds just as soon as after you washed your hands and all that to say, I'm looking around the room,
Mm.
and then ask for specific equipment that may be related to that station or to the universal cues you might have seen.
Yeah.
So that's the important thing. And what the child is doing, is he comfortable? Is he pink, blue, whatever?
Yeah.
Right. So 4 stations. And cardiology, like I said, almost mandatory. So you have usually what you'll get is VSD, pulmonary stenosis, atrial septal defect, murmurs, because they're now playing it in as an
Yeah.
audio clip. You would have the murmur like we saw last time of a stenosis and
Yep. Yep.
regurgitation. Last is quite common, is the operative scar with a murmur. And the advice for this would be, you are expected to comment on what could be the pathology with your findings at present, not what happened initially.
Right.
So if you are hearing a VSD murmur with a scar, you say operated child and the findings are consistent with a VSD.
Right.
And then the examiner can kind of probe you and take you further. Well, that's fine. But don't go that, oh, he had this pathology. So this is what I think is important, because cardiology is a lot of physics and fluid
Yes.
dynamics, really. So what are the normal pressures? A very common picture you have seen, I'm sure. Now, if I had to ask you, what is the pressure in your left ventricle? What would you say? What is the pressure in your left ventricle?
Uh,
It's at 3 months of age.
mm.
So the left ventricle would be about 60 to 90. Right ventricle is about 15 to 20. Your aorta will be 90 to 50. Pulmonary. So here it's showing first sound, second sound is kind of almost pan-systolic. And the character will be different.
The murmur of a ventricular septal defect is holosystolic and often accompanied by a palpable thrill. Listen to a patient with a ventricular septal defect. I will start with 3 beats and then add the murmur.
This is a murmur you probably will not hear anywhere else, except maybe in the exam, because it was sent there. However, so a 6-month-old distressed and pale for 6 hours.
Mhm.